Addiction is a family disease. Recovery is a family thing. Once the child moves into recovery, there's probably still a lot of familial anxiety and everything that goes with it.
The child is the one who is the acute stressor, and the parent's PTSD was really developed in response to, the anguish of living through somebody else's addiction.
Even if the child has been in recovery for some period of time, there still is anxiety and fear and expectations.
Right. It's like, okay, so you're good now, but the last time it lasted 2 months. So, okay, even though we're 2 months out, that doesn't mean anything to me. I'm still going to stay in my state of anxiety and hypervigilance because I have my own trauma. So that's parental PTSD.
So what is your message to parents who are in that place right now?
It's tough. That's what I would say first and foremost. To be acutely worried about somebody would be like how we experience the world, let's say post 9/11, the next day when it was 9/12, all was not okay. So when something impacts you in a traumatic way, I think the first thing to understand is A, I'm hit, and B, now I myself have to recover from this, and it's going to take time. So it's not just you and you were the problem and all is okay.
Speaking of time, I know if I had a child who was suffering with SUD, I would want to fix it right away. I would say, okay, you've been sober for a couple months. Let's move on. Let's keep it going. What is your message to parents about time and the time it takes for the family to heal?
Most people understand what it means to have had a baby. So if somebody has, let's say, 1 day of recovery, as opposed to 1 month of recovery, as opposed to 3 months of recovery, I try to help them to remember what it was like to have a newborn. And what it was like on the first day that you brought the baby home, and it was like this, and then the baby's really a month. And though the parent is thinking, well, recovery-wise, they should be okay now, if they reflect back on what it was that they expected from a 1-month-old, it wasn't that they should be walking, it was that they should be acting like a 1-month-old. So it helps to give them a perspective on understanding the longitudinal nature of recovery. So that sort of then gives them perspective on what they can expect.
Time takes time, as we say in this movement. What does that mean to you?
Time to heal is a very difficult concept. If I'm the parent and you're the person who has the addiction, I'm going to say, I want you to be well. Right? Because of course I want you to be well. But what I'm not aware of is I want you to be well so that I myself can stop feeling the anxiety I'm feeling every day. So then what happens is my sense of well-being, even in the recovery stage, much like the addictive state, is still tied to you, which puts me in a precarious position, right? Because if you go out tonight with your friends in a very normal way and actually feel like you're, finally alive, I'm going to find that very stressful because I'm stuck in my brain with the what if. And then if I put that onto you, then you're going to accuse me of always being anxious and nothing you do is right. And so we get into a whole negative state in the early recovery, even though you're doing well. So time does take time for me to witness you go out, come back again, maybe this week, maybe this weekend, and start to see that maybe she can do this. Maybe I can relax.
Trust has to build.
Right.
But what are some things that parents can do to not consistently live in that state of fear and anxiety?
I think the first thing is to appreciate that it's not easy to do, right? In the very beginning, you're embedded in the anxiety and fear. You're really a victim of terror. This terror occurred over a period of time in episodes, for the most part, where things were okay, then they were not. Then there was a crisis, then there was not. So what they've learned then is I can't trust time, really, because it can happen again, anytime, any place. I could get the call, they could be back using, and my life in the moment feels over again.
Wow, you're right. Yeah.
Yeah.
And that terror that you mentioned is trauma.
It's trauma. It's
Right.
trauma. You can have several children. Let's say they're going to be home at midnight and, they walk in the door at 12:30, or you call them and they don't pick up. So you say, okay, they're busy, they're out with their friends. If you have a child in recovery who is an addict and they say they're going to be home at 12, then already at about probably 11:30, you start becoming hypervigilant, looking at the clock, thinking, he or she's not back yet. Then you call them at midnight and they don't pick up the phone. And what does that feel like? It feels like, major anxiety. I'm just starting to work myself up. Something happened to her. And then when she does finally come in, she could actually walk in the door at 12:15, 15 minutes late. And I'm in an explosive state. Like, where were you? Why didn't you pick up your phone? What's the matter with you? And flip into the anger, which is the antidote to the fear and terror that I experienced. I myself am traumatized, and I haven't necessarily gotten treatment for that, to learn how can I restore and work on restoring my sense of trust to you. And what do I do when I'm having an attack, like a codependent meltdown attack? How do I check myself before you walk in the door and I go, And if you take SUD as a chronic deadly condition in your child, just label it like that. Like, I'm the parent and I think my child has this illness from which they can die, much like any other illness, then my response to it is understandable that I'm going to get PTSD or trauma in response to your chronic illness. I become the caretaker to your chronic illness and I'm terrorized I'm going to lose my child. So nothing more traumatic really than that, actually, when you list it out.
I can't think of anything worse than losing a child.
No.
What you're feeling, this trauma, all the triggering, and this PTSD is real.
And that you yourself need to understand that you also have to recover, from this. If you're the somebody who loves a person who has Alzheimer's, for example, then we understand that there's support groups for caretakers because they burn out. So we're saying really the same thing, that you can burn out from this by being the parent to a child.
Let's talk about how the trauma of the young person with substance use disorder affects the entire family, and in particular, other siblings.
Each child starts to take on their own role in response to the child with the trauma. It's not easy to grow up with your own fears that my sibling's going to die. It could be in part too that if they're close enough in age and you did drugs with the person growing up in a sort of normative way, like smoked weed together, it could be that you then come to feel guilty. So each person's individual experience with that child who has the identified SUD, is going to have their own response based on that. The siblings also have their own issues in response to the parents, because what's happened is that their parents have not been able to pay attention to their own needs in growing up. The child, as they say, the squeaky wheel gets all of the attention. It's very hard to be the hero child and see that even though the child got into recovery now, they're still getting all the attention. Everybody's still focused in that direction. Siblings also can be angry with the parents or with the child with the SUD because they have ruined their parents' lives and that they're killing mom and dad. So that's going to deprive me of my parent because look at the stress they're always under because of you.
So it's important for parents not to neglect the other siblings. And I would assume that then asking for help and receiving professional help would be, enormously beneficial.
Right. But like anybody having to ask for help, you'd have to acknowledge I need the help as the first step. And so there is that own denial, because if I think my insanity in that moment that I just described is totally predicated upon your behavior because you were late between 12 and 12:15, and if you weren't late 12 to 12:15, none of this would happen to me. I'm still looking to you to be the solution to my problem. I'm not owning the fact that I've just gotten dysregulated onto myself. So, I think of it again like a tennis game in a way. And, you can always be just swatting the ball. But hopefully, if you get a coach, they're going to tell you, wait a second, there it comes. When it lands here, you have a choice of how to respond. So respond from a different spot. Because if I respond from a different spot, that's going to force you to respond to me in a different way. So that's how change is going to occur between us.